Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochke Eskam SLFNHA Visionkade. Miwa Kegunenan, Iwanun Keguns Wichi Guyagban, Ima Ishkunaganang Kazgabeshig, Egochke Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bojo waje gidna egama ngagaku gajmawe oguma kegunenan iwenun akuzi mujigaunan imanike Sioux Lookout First Nations Health Authority. Welcome to today's program. We're excited to have Ashley Pressinger, Project Manager for Mental Health and Addictions at SLFNHA. Welcome, Ashley. Ego mina kchibojo gidnguna, migo etchgidnguna nomga bijindausiang. Ego ma andiamen Ashley Pressinger, ijinkaz our Project Manager. Ka ganunu enanung. Ego tchkeahi. Oyagamen jimin good majmaskin enanadochinzgadig. And Quyun. Ashley.
Miigwech for having me. I'm happy to be here.
Thank you. Mental
health and addictions is a growing concern among the communities in the Sioux Lookout region. Can you explain what the project is about? Miwe kaganunueun egotskeahi awyagamin jiminugud majmaskin maajugu and Shinwag Awyagwed Gaisat Egotske Maj Ehtanendamwaj Iwed Nugaun Judge Ishkunaganan. Without the most namna Keguneniwe Gayan Khadaman.
Yeah, so the mental health and addiction crisis in the North is critical. That's why the Chiefs in Assembly passed Resolution 2308 at AGM, declaring a public health emergency and social crisis. In the resolution, the Chiefs asked the Sioux Lookout First Nation Health Authority to form a task force. The goal of the task force is to tackle the systemic barriers that make mental health and addiction services so hard to access in the communities. This work is guided by the Mental Health and Addictions Model, which was created in 2023, with input from communities, tribal councils, and other key partners. This model has helped identify the project's top priorities, which at this time are youth and treatment. The resolution also called for a media campaign and for SLFNHA to advocate for funding to support this work. Last November, 2024, SLFNHA hosted a mental health and addiction forum in Winnipeg, Manitoba. The insights from that forum continue to shape our project goals and outcomes, highlighting the urgent need for change in how we provide mental health and addiction services to the communities of Kiiwetinoong.
Kagchimatsig mamitninchigan mina apatchigewapinewan tebwepiko kagichinamat. Mihiwe ogmahkana kagi unchi shabunamuaj ankiube banune 2308 ekchimatsig motigewanan. Ankiube banunk Ugmahkana Ogi Kagwetmawan SLFNHA Che Unatut Nanadaw Kenjgaunana. Anonent Che Mihkan Ka Kipskagema Kaninik Mambidninchigan Wichiwawan Mina Abadgewapinewan Apitskawan Chi Animak Chi Unternigateken Wichiwawan Kitabunanak. Huwe anukiwan opiminizahan omamituninchigan mina abadstigewapinewan wichiwewanan kagi unachigadik 2023 kagi wich towaj abiwanak ukabuwanak tribal councils mina kutagiak. Huwe nachigewan ogi kich wich Don Kenikanan Kadenik. An Kiiwetinoong kaye ikadomagan Utapachimog Wiindamekewinan mina kaye SLFNHA Chikanonat Okeman Chiminugatsunyan ke abachach. Otanang November SLFNHA ki mawanduh chige mamadne chigan mina abach chige wahpenewan unje wede Winnipeg, Manitoba. Ɂ斐ᑕᒪṕეինαν kagi untenamak mi ese pembawanukuyak epayahtenamak kasinonteseak mamatnechikaning mina apachchigewahpenewaning kasiwichakwa Kiiwetinoong apuwanak.
It sounds like communities are really prioritizing mental health and addictions needs. How will this project support community efforts to address this crisis? Mibugo maujugo muntago niwe maujga gogo mamawan huaj ishkunaganan chuichiaj udanshin nimwan udanshinabe mwan ka minjiminagwaj majmashkina gotske chigaganunda ukenda nawa kegunen das iwanun hayagen Kunj Weedstodge, Abastodge, Migadamot.
Yeah, so the Mental Health and Addiction Project is all about challenging the status quo. We've heard it loud and clear from communities, tribal councils, and our partners. The current system just isn't working, and the need for support is growing. So the project aims to bring organizations together so they can adjust their services and close the glaring gaps that exist. We're also looking inward at SLFNHA, examining how we address mental health and addiction needs ourselves. We know that resources are limited, so a key part of our work is to figure out how partners can collaborate and we can all work together more effectively using the resources that we do have. As part of the Strategic Policy Planning and Quality Team, SPPQ, the project will help develop and change policies at SLFNHA. And the team is also here to support communities in creating their own policies, practices, and procedures to address mental health and addiction needs in their own terms. All this work is guided by recommendations from previous reports that have been accepted by the Chiefs in Assembly, ensuring we're following best practices as we move forward.
Umamatnenchigan mina abachchigewahpenewan anukiwan maunehigate gehte anukiwan gainatik. Mawach nipayahte te tawamen apuwanak ukapuwanak tribal councils mina kutakiak ka witanuki makwa huwe abachtagan kawan anuki magasinon chiwi chichigate ahpich andawin chigate Huwe anukiwan uwi ukapihan Wiindamekewinan che maminunamwach upimwitchike winwa mina chikipahamwach kashe pahpanisenik uwi chihiwe winwa pinchiahitashkaye SLFNHA Nintena Pimen an Eshe Kanawa Pantamak Mamatunin Chigan Mina Abach Chigewahpenewan Keninaunt Ningkentamen Abat Tagan Enodesek Egwa Kagichine Dagwak Nintano Kiiwetinoong che onentamang ante Wiindamekewinan mina Wiindamekewinan keki shiminsek utabat taganawa ka ayawach abachtuach huwe gawi abatak wasanigan unachigewen gawian ito tamuach mina kagche nagachiwach anukinaganak huwe anukiwen oka onnahtuunan minachi aanjittuut unahkongeonessan ihima SLFNHA. Anuhkinaganak omata ayawag chi wiithawach apunan chi unahtuunach uttunahkongeonesinin ke ischikenich mina kenischikenich chi anuhkatamwach mametunenchikan mina apachchikewahpineunenne Kiiwetinoong wahtuutamwach. Huwe anuhkiwin onche wiithhiwemakanon Kiiwetinoong utanank kaki pakitinikatekin ukamahkanak umawachituwinnuwank kehchinachiminusik ahpinikan kamachayak.
You mentioned the task force. Can you tell us a bit more about the role the task force plays? Iwe gigi anmudan. Iwe mamon khiun task force kajgadig. Aunenag awenugi maga en huad gedawin de moshnam.
Yeah, absolutely. The task force was formed following the 2023 resolution and began meeting in early 2024. The role of the task force is to oversee the project and direct the work plan, determine outcomes, and set priorities. The task force's main goal is to break down the systemic barriers that have made mental health and addiction services inadequate and inaccessible across Kiiwetinoong communities. The task force work is all about creating real, lasting change. They're challenging the current system because we know it's just not working. Every step they take is guided by recommendations from the past SLFNHA reports, the Mental Health and Addictions Model, and by the insights from the 2024 Mental Health and Addiction Forum. This ensures the goals are grounded in best practices and the real needs of the communities.
Kchitedago, Watanuki Unasawag 2023 Anuhkimas nahigan kaki pagitinagatek mina niki machi mawachhitamen wipachka matakentek 2024 mi ina patiswach utanuhki chipeme kanawentam wach anuhkiwenen mina chipimen sahang inachikewenen che wenen tankeni sigishgatenik mina keni se ni kanen takwanenek utanukatan ende ninawinang ka kipskekemakanenek ustikwanen mina abachchigewahpinewen wichiwewinan Egagaki tepe namuach Kiiwetinoong kahkink. Otanuhkatanawa wichiwewinan chit nehpich anttuach. Omawane hanawa apachtakanan kentamuach egamsawach hanuhkimagahkin. Tasso tahkuhkiwen opemen sahanawa Kiiwetinoong SLFNHA minench mametunenchikan mina abachchigewahpinewen abachtagan mina kagi tashenchikateken 2024 huwenawan isi ayawanan mi huwenene Kechnach mawach kamen senek mina ke menuskakoch utapawinawa.
You have mentioned service area gaps. Can you elaborate on this? Hegamina gigian mudan yue kaz gahkapt segen anhunen ahin apnuga egagai segen zgi wichinj anshin Iwen gain apned kago wichinj. Gedawin de mosnamna kegunen and Iwen un gaidaman.
Sure, a service gap is the difference between what a client expects from a service and what they get. This can lead to a breakdown in trust and a lot of frustration, especially in vital areas like community health. We have seen some of these challenges firsthand in our region, particularly with mental health services for youth and families. But what's causing these gaps? So for one, there's the complexity of client needs. We have many high-risk youth with complex issues, and it's a real struggle to find the right treatment for them, which can create a revolving door situation. So another major issue is staffing and resources. Many organizations are facing severe staff shortages. They're having a really hard time offering competitive pay to attract and keep mental health professionals. This is a big deal, especially when private practices can offer higher per diems, pulling talent away from the salaried positions in community. This leads to a lack of consistency. When counselors are on a fly-in, fly-out model, visiting communities for only a few days a month, it's nearly impossible to build long-term, trusting relationships that are so crucial for effective care. So there's also systemic funding and referral challenges. Inconsistent funding from sources like Jordan's principal creates uncertainty. Plus, there's no standardized system for referrals. Service providers often don't know what other organizations offer or where to send clients, which creates more barriers for getting help. These gaps in service aren't just minor inconveniences. They have a real impact on people's lives and the well-being of our communities. It is a complex problem with many moving parts, from funding to staffing to the very structure of how care is delivered.
Kabansig wichiwen kaichigadik, hawe utakosi kasipaksen machisi wichhinch, mina tebwe esinagwanik wichigoen kaichigadik. Huetas ega kwayaka wichinch awya, ane pikuska tebagen muewen, mina mistahi kisuwenta mowen ani aya, hima wuta ahkusi wichiwewening. Nimpe wabandamen ohuwe izusewen, ka tananokiank, mawachuta oshka tazihkank mina tibenchigewening. Kegunentas kawan chipansik. Nestam mawaj anem sene otahkusi Wiindamekewinan. Nintayawamen mishin oshkatisak teta koka niskisenik upematisonawa. Anemanene che mihkikatenik keshe menowich hindoa. Che moche mamishkot squanta wewach. Wichiwewening chisnagosit. Kutak minak chi itsewen anukkinakanak mina apachstaganan. Machine unachikewenak nontesewak anukkinaganan. Mawach anemestowak koyakchitipahigewach mina Jemenawach anukkinaganan. Tabskot ahkusiwe anukinagan. Kichinen tagwan huwe. Wemstegosi kank win nawat mistahi tepahamawa anukinagan. Ehwenche mahkamens utanukkinaganan anshin. Kawentas koyaki pimawitgesin. Umami no muwek ka moche pitashich machiashich ahachina pesgo kizis mawach anmanche menowich hinjutakosi huekash na kwakwichiwewen anemsewen kaye sonia minaka machi nizahwench utakosi eka ka mashkawahte tipahigewen tabsko Jordan's principal kawan sagkakenta gwasnon Kiiwetinoong kawan daskaye besikwan jisena gwak machin zahuwewen wit hiwek kawan musag ogkenta sinawa an ese wit hiwenit kotagyan opimawutsigen nanda antegation is a wawat otakosimuan mit sappen awasme is matsenika kakwe wich hawat Huenoman ka pakan segen which hiwewenan kawanin iko tahtapangi mawachuko kchis saha awiya upamatasoning mina omino ya wenwa apuwanak Aneman huwe is a sewen mina machina tenon ka wakawi magakken Kiiwetinoong anokinaganak apewen apin kaye an esinagwak Kiiwetinoong.
I can see that providing adequate mental health and addiction services can be difficult. How does the project intend to address these gaps? Ego eskam nagwanun ego esegeniwe awiyaga ganunj and kyun ego tske awiyaga gawichinj ga gamanjimin goods majmaskin mawjake animak mawjugu kchen kyun anin iwe ga niganskaman and kyun an gawish chigaj anin gedu damajiwen tske gistoaj goecht du damajiwe and kyun.
First, we need to address the staffing crisis. That means investing in our mental health workforce. We need to make these positions more competitive with salaries and benefits that can compete with private practices. By ensuring counselors and other professionals are paid fairly, we can attract and retain the talent needed to build consistent, long-term relationships with clients and communities. Next, we need to move beyond the fly-in, fly-out model. Building trust requires consistent presence. Instead of short, infrequent visits, we should explore models that support counselors from the communities they serve. This not only builds rapport, but also ensures that care is there when it's needed, not just on a scheduled visit. We also need to improve coordination and communication across the system. This means creating a standardized, user-friendly referral system so that service providers know exactly what's available and where to send clients. This would help eliminate the confusion and frustration that can stop someone from getting the help they need. And finally, we need to address the systemic funding challenges. Inconsistent funding creates a lot of anxiety and uncertainty. We do need to advocate for consistent, reliable funding that allows organizations to plan for long-term and provide stable foundation for their services. So closing these gaps won't be easy, but it starts with a commitment to our communities and the people who need these vital services. By tackling the issues of staffing, consistency, communication, and funding, we can begin to build a mental health care system that truly services everyone.
Nistam kikakanotaman kano desewaj ankinaganak. Chamasko wasentwa ke mamitunen ankinagananak. Huenowan anokiwanan che nanke tebahigateken, tebahigewan mina wichigonan tabskut wemtgozigase tebahigech. Nanke tebahamawentoa umam mina muwek mina kotagiak. Kiche anokinagana kitaki misawenta mihamen chibi anokagoyak mina minchiminen toa kinwes chi anokagoyak mina ega ahajina chimuchi ainashnanwank chitotamakwichiwewen we Wiinahtuyan te pakenem wewen musag himakika aya. Eka ahachina Wawikata Kiiwetinoong Wiindamekewinan Wiindamekewinan Apiwining ka tananukiwach kawan ixtamenowitanukimwewen ta onchimakasanon wichiwewen kaye che ontinikatik pikuanahpi antawen chikatik kawan ixta wawikata che pikiwikech che Kachikate kaye Wiindamekewinan mina kanonituwen howe ka in kwatek ahkusiwe wichiwewen che wena chikateken ke ayesheneza hontoa otahkusik mina ahkusiwe kamekon maskkiwe kamekon chikikentamwach kekunen wichiwewen wete eyakwen kaye ante keishenezahwentoa otahkusik mina skoyach chikano chikatek shoniyawi nontesewen nan Eka ka tepsetshonia mistahe onchimakan kochanementamowen mina machentamowen che kano chigetamawatamach che tepseak ke pemewechik ke tamakewinan che menusek wasanigan mina che maskawahtek kipahamak kasi papanisek kawan wentasnon chipakitan tuzo kantawahkwa kitapewenanak mina ka apachtoach kiwichiwewenanan anohkat tamak kitanohkina kanananak Utesewenoa Peshikwan Jesus Anokiwan Kanonitawen Mina Shonya Kikaki Anne Ojastoman Mametunen Chikan Wichiwewan Kakana Awiya Ke Wichikot.
This is important work. It is great to see that the chiefs, communities, tribal councils, and SLFNHA are all so invested in creating a better system for mental health and addictions. How can community members get in touch with you? Maujugu kchina daun yu en kyun kanigan skaman gab mud gade yu. Egotske maujugu mun nagon awnu gugu makanak iskun ganan. Egotske gaya bishta mawaj in tribal councils gajadin. Egotske hey SLFNHA kamama en kyaj kagogue wichi hawaj an shinuan Kiiwetinoong gaun jiwaj kakna. Egotske Andgegis ganun goimban angesgapan jigi ispinaw yagegun wika gwajmak angedu damapan andgegis gudwat.
Yeah, so anyone can email me at ashleyprestinger@slfna.com, which is ASHLEIGHGHR@SLFNHA.com. I am available to anyone wanting to ask questions or be involved in this work.
Begoya nagagi pimasnahamag ashley.presenter@slfna.com. Oman nantaya kispinawya wi kakwetwet skegone nanta wa which tot anokiunen.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapanagiwa atibseg noom imaga Wiindamekewinan akwazio ankyun gabmujgadig ima SLFNHA Radio Connect. Mawajibu aikid nanun ishunganan juidan kwimanda anshinwagiwa anshinabeg egotske anin gegizwichigoyamban iwa akwazio ankyun gabmujgadig. Migat.
Recorded and produced at Wawatay Communications Society.